Hello everyone, my name is Justin Clancy, and today I will be doing a comparative analysis of Brazil's healthcare system. The Brazilian healthcare system is known as Sistema Único de Saúde, or SUS for abbreviation. SUS was conceived during the 1980s as part of the social movement aimed at Brazil's redemocratization and officially instated in 1988 by the new Brazilian Constitution. Under this constitution, it was stated that the new healthcare system would be free access to all comprehensive services, including primary outpatient specialty, mental health, hospital care, and prescription drug coverage to all residents, visitors, and even undocumented individuals. The three principles under SUS included 1. A universal right to comprehensive care at all levels of complexity, primary, secondary, and tertiary. 2. Decentralization with responsibilities given to the three levels of government, federal, state, and municipal. And lastly, 3. Social participation in formulating and monitoring the implementation of health policies through federal, state, and municipal health councils. The organization of the health system starts with the Ministry of Health, as they are responsible for national coordination of SUS, including policy, development, planning, financing, auditing, and control. State government duties include regional governance, coordination of strategic programs, and delivery of specialized services that have not been decentralized to municipalities. The health departments in the 5,570 municipalities largely handle the management of SUS at the local level, including co-financing, coordination of health programs, and delivery of health services. Community participation in the public health system is guaranteed by the Constitution at all levels of government. Health councils and health conferences are composed of 50% community members, 25% providers, and 25% health system managers. They are responsible for deliberating public health policies and monitoring their implementation. From the American health system perspective, unlike Brazil's healthcare, the United States has a slightly different outbreak. The government-offered insurance is not universal and not divided equally amongst the public. The public health system is divided into Medicare, Medicaid, military veterans, and a state children's health insurance program. Medicare is for those over 65, Medicaid is for those on low incomes, and the state children's health insurance program is for those children whose parents do not qualify for Medicaid. Along with the universal coverage, Brazil also offers private health insurance, which is delivered through the employees of public and private companies, as well as individual healthcare, in which citizens can also contract an individual or familiar medical insurance. Compared to Brazil, the U.S. private healthcare system has employer-sponsored insurance and an individual market. As shown on the graphic from the previous slide, employer-sponsored insurance is the most common health insurance, which is distributed through a benefits package for employees. The individual market is destined to either self-employed or retired people. From a hospital perspective, there are a couple differences between the two countries. In Brazil, the federal government contributes to the finances and delivery of care. Roughly 62% of the hospitals are private, while 38% are public. Generally speaking, the Ministry of Health transfers funds to state or municipality for reimbursements. In the United States, there are roughly 20.2% of state-owned hospitals, 58.5% are nonprofit, and roughly 21.3% are private. The hospitals are funded by private insurance, government insurance programs, and personal out-of-pocket funds. A quality of care and cost analysis of the countries shows the United States ranking last among some of the top 11 high-income countries, including the UK, Netherlands, Norway, Germany, Sweden, France, New Zealand, Canada, Australia, and Switzerland. Other surprising facts include having the highest rate of avoidable deaths and highest spending as percentage of the overall GDP at roughly 18%. The overall consensus of the money spent on healthcare and the quality of care is that the system can be much improved. On the other hand, being a developing country, Brazil is going to have different standards relevant to their current status. For one, Brazil's healthcare is actually considered one of the country's leading attributes. In the more developed areas of the country, it is noted that they have relatively modern facilities and state-of-the-art medical equipment. However, this quality varies based on location and socioeconomic status. As of recently, Brazil's cost of healthcare has been on a steady incline over the years and currently sits at 10% of the country's total GDP. The graphic picture here shows interesting results of the public health outcome in relation with the economic outcome regarding the COVID-19 outbreak. Despite having a much higher income, the US was actually ranked as having roughly the same health outcome with an even worse economic outcome when compared to Brazil. Other outcomes include Brazil with a life expectancy of 76.6, infant mortality of 1.39%, a suicide rate of 12,500 per year, an obesity rate of 61.7%, and roughly 1 million people living with AIDS. From a US perspective, again, compared with the same 11 developed countries, the US was found to have the lowest life expectancy, the highest suicide rates, the highest rate of chronic diseases and obesity, and an infant mortality rate of 5.6 deaths per 1,000 births. This slide shows visual representations of the United States and Brazil performance ratings and healthcare spending. On the left, we see the United States ranked last in access to care, administrative efficiency, equity, and healthcare outcomes, yet second in care process. Under that, we can also see the performance compared to the overall cost as well, in which the US is far behind any other country. On the right, we see Brazil's healthcare access quality and the improvement of 17.3 from 1990 to 2016, as well as the drastic increase of spending over the first decade of the 2000s. Due to Brazil's economic status relevant to the developed countries, as well as their geographic location, they're going to have different threats to their current healthcare system. Brazil is found to have shortages in public funding, suboptimal resource allocation, and weakness in healthcare delivery. They are also at threat with economic and political crises that pose a major risk to universal healthcare and health gains. This ends up having a detrimental impact on the poorest and most vulnerable populations. Lastly, due to their geographical location, Brazil is also at risk for many infectious diseases, which has been seen to overwhelm their healthcare system and has been prone to record outbreaks, including yellow fever in 2016 and 2018. Thank you for your time. Please see the references used throughout this presentation.